Health in Sierra Leone, Wikipedia audio. In terms of available healthcare and health status, Sierra Leone is rated very poorly. Globally, infant and maternal mortality rates remain among the highest. The major causes of illness within the country are preventable with modern technology and medical advances. Most deaths within the country are attributed to nutritional deficiencies, lack of access to clean water, pneumonia, diarrheal diseases, anemia, malaria, tuberculosis, and HIV/AIDS. All medical care is generally charged for in Sierra Leone and is provided by a mixture of government, private and non-governmental organizations. There are over 100 NGOs operating in the healthcare sector in Sierra Leone. The Ministry of Health and Sanitation is responsible for organizing healthcare, and after the end of the Civil War the ministry changed to a decentralized structure of health provision to try to increase its coverage. Sierra Leone is divided into 13 health districts that correspond to the districts of Sierra Leone except for the Western Area Rural and Western Area Urban districts, which are combined into the Western Area Health District. Each district has a health management team and an average of 50 peripheral health units and over 100 technical staff. The management team is responsible for planning, organizing and monitoring health provision, training personnel, working with communities and supplying equipment and drugs. Health infrastructure. The FUs are designed to be the delivery point for primary health care in the country, and there are three main types. In April 2010, Sierra Leone launched free healthcare medical insurance, a system of free healthcare for pregnant and breastfeeding women and children under 5. A UN Population Fund representative said that medical equipment had been ordered and some drugs distributed as part of the new healthcare scheme, but the coverage was not yet 100%. The initial setup cost of the scheme was $19 million, and it is expected to save the lives of more than 1 million mothers and children. The Community Health Center carries out health prevention measures, cures and health promotion activities, and is in charge of overseeing the other FUs in the area. It is planned that each chiefdom, the unit of local government in Sierra Leone below the level of district, should have at least one community health center. Community health posts perform a similar function to community health centers but have fewer facilities and are used to refer patients to the health center or the district hospital. Maternal and child health posts are the first level of contact on the ground and are located in smaller towns with populations between 500–2000. Much of the healthcare infrastructure was decimated during the Civil War, and the health service is still in the process of being organized, with hospitals and FU being rebuilt or created and staff being trained. Healthcare workers had gone on strike over the plans in March 2010, arguing that free healthcare would increase their workload and working hours. The government settled the dispute with pay rises of 200 to 500%. Observers argue that many of the women concerned do not even know they have a right for free medical care, and that the law would remain a paper tiger if more earnings from the extractive sector was not invested in the country's healthcare system. The scheme is funded mainly by the United Kingdom and United Nations, who have paid to refurbish hospitals, supply drugs, and pay healthcare professionals wages. The UK alone has agreed to pay for a year's worth of drugs for the program, and the World Health Organization has provided blood banks in each major town. The British government's funding came from the Department for International Development and amounted to $22.6 million to fund the scheme for the next 3 years, from a total allocation of $70.5 million for the 10-year-long Reproduction and Child Health Care Plan. UNICEF also received $7 million from DFID to provide medicines for pregnant women. Traditional medicine forms part of the primary healthcare system in Sierra Leone. The Traditional Medicine Program, run by the Ministry of Health and Sanitation, has constructed a training school at Makeni, a healing center at Kono, and conducted workshops to promote cooperation between traditional medicine practitioners and orthodox medical workers. Members of the program have also located and collected plants from throughout Sierra Leone used for medicine. A 2006 national survey found that 84% of the urban population and 32% of the rural population had access to an improved water source. Those with access in rural areas were served almost exclusively by protected wells. The 68% of the rural population without access to an improved water source relied on surface water, unprotected wells, and unprotected springs. 20% of the urban population and 1% of the rural population had access to piped drinking water in their home. Access to an improved water source does not give an indication about whether water supply is continuous. For example, in Freetown taps were running dry for most of the year in 2009. People collected water in containers wherever they can, and those who can afford it install water tanks on their houses. Even the fire brigade used its trucks to sell drinking water. There were fights between firefighters and employees of the Guma Water Company, responsible for water supply in Freetown, sometimes resulting in deaths. The 2014 CIA estimated average life expectancy in Sierra Leone was 57.39 years. In 2015, after improvements in health in other poorer countries, life expectancy for both men and women was the lowest in the world. Free healthcare scheme. Yellow fever and malaria are endemic to Sierra Leone. Sierra Leone suffers from epidemic outbreaks of diseases including cholera, Lassa fever, and meningitis. Sierra Leone has a prevalence of HIV/AIDS in the population of 1.6%. In 2014 there was an outbreak of the Ebola virus in Sierra Leone. As of August 4, 2014, there had been 691 cases of Ebola in Sierra Leone, and 286 deaths. Mental health care in Sierra Leone is almost non-existent. Many sufferers try to cure themselves with the help of traditional healers. During the Civil War, many soldiers took part in atrocities and many children were forced to fight. This left them traumatized, with an estimated 400,000 people being mentally ill. Thousands of former child soldiers have fallen into substance abuse as they try to blunt their memories. There is one primitive psychiatric facility in Sierra Leone. It is estimated that there are about 450,000 disabled people in Sierra Leone, though number could be an underestimate. Common disabilities in Sierra Leone include blindness, deafness, war-wounded, amputees and post-polio syndrome. Maternal mortality statistics in Sierra Leone are among the world's highest. 1 in 8 women risks dying during pregnancy or childbirth. Traditional medicine. Water supply and sanitation. The 2010 maternal mortality rate per 100,000 births for Sierra Leone is 970. This is compared with 1,032.7 in 2008 and 1,044.2 in 1990. The under 5 mortality rate, per 1,000 births is 198 and the neonatal mortality as a percentage of under 5's mortality is 25. In Sierra Leone the number of midwives per 1,000 live births is 1 and the lifetime risk of death for pregnant women 1 in 21. Hospitals. Health status. Life expectancy. Endemic diseases. Infectious diseases. Discrimination based on HIV status is illegal, but HIV-positive people are highly stigmatized, with HIV-positive children being denied schooling, adults denied jobs, and abandonment by families common. Persons with HIV are often driven to suicide. HIV/AIDS. Ebola. Mental health. Disability. Maternal and child health care. Health conditions and human rights in Sierra Leone. HIV/AIDS 2.